I had pericarditis for over a year, and I know I would have recovered significantly faster had I just known what I know now. In this video, I want to try and share that with you as if this is a window to the past and I'm advising myself. So let's get started. Fundamentally, pericarditis is an inflammatory condition. If you imagine you have the heart like this, and you have a fibrous sac around the heart. This is the pericardium, and it's inflamed. And the inflammation basically causes it to compress against the heart, causing pain and discomfort for the heart itself, hence the chest pain, right? The issue you have is that this inflammation doesn't like to go away. This is the problem. Inflammation is the problem. And so the goal is basically doing two things. One, decreasing inflammation in general, and two, increasing the body's ability to recover from said inflammation or damage. So let's talk about the kind of care that I received and that you probably received and the kind of position you're probably in. So you probably went to the hospital with heart attack-like symptoms, right? It's quite distressing. You then get told what it is. It's pericarditis, inflammation of the pericardium. And then you also get prescribed medication. And that medication is probably colchicine, ibuprofen, as well as some kind of stomach liner to prevent the ibuprofen from affecting your stomach. The typical protocol for that is 3 months on the colchicine and 1 month on the ibuprofen. That's all well and good. But the thing is, you don't really get much more information than that. What I want to do is fill in the gap, because I actually ended up having this for a year before I actually got fully better. What tended to happen for me was I would improve a bit and then crash, and improve a bit and crash. And I got so desperate to improve that I did an enormous amount of research, and I'm going to try and display that to you. Now, I'm going to tell you exactly what I did in context of these two ideas. First things first, I bought a smartwatch. You can look on the pericarditis forum. Lots of people say you shouldn't train if it's over 100 beats per minute. And I tend to agree with that, because the more beats your heart has to do, the more contractions, the more it's going to annoy the muscle. If you imagine you're doing bicep curls of some kind, any kind of contraction is going to cause some strain to the muscle, okay? And if you imagine, you can cause strain in two ways. Repetition, so doing lots and lots of reps, so an infinite number of reps, or by weight, right? You have to consider that your heart is mostly works on reps, okay? So reps per minute, which is an intensity, okay? Now, typically when the heart is doing something that's more active, so say running, weightlifting, any of these things, the heart rate is higher, okay? But when it's higher, it's also working harder as well as faster. That's called stroke volume, which basically means that the heart contracts harder, meaning more weight as well. So it's harder and faster, which means that that pericardium is being hit faster and harder, which is making it harder to recover. So that's why you need to rest and keep your rate down. So a higher and faster heart rate causes more inflammation. Okay, so generally speaking, we want to lower your average heart rate and the intensity or stroke volume with which it's contracting. You need to keep the heart rate under 100 beats per minute. Okay, now the reason this is so important is because when your body is in that state of stress, it can be very, very easy to elevate the heart rate. When I was just having a regular walk into town, and I only got this after about 6 months because it was a gift, I didn't think to buy it, I realized my heart rate was at 125 on a walk. And you don't think about these things, and maybe it's an ego thing. I was an athlete. I thought I'm very fit. But you don't think about these things. I was an athlete. I thought I was very fit. 125 beats doesn't sound fit, so I thought a walk couldn't possibly be too much for me, but it was. And I had to come to terms with, if I'm going to have a walk, it needs to be slow. And this helps me keep track of those things, those little things that get in the way that you don't realize are actually contributing to that problem. The next one is probably going to bore you, but it's kind of one of those obvious ones. Sleep. If you're not getting enough sleep, and trust me, you need more sleep than you did before, even if you were training hard, you're not going to be able to recover. Sleep is the most anabolic state that your body can be in naturally. And in fact, it's the most anabolic state your body can be in, period. You don't even get this level of recovery or anabolism with steroids. Sleep would be the strongest anabolic thing that you can take if it were, right? If you don't have this, it utterly ruins you. It ruins normal people, it ruins athletes, it ruins everything. So what are the components of sleep? So first of all, hours, right? But also timing, and more specifically, consistency. For hours, when I was off ill, and I was privileged enough to be able to take time off work for this, I would typically allow myself to sleep for as long as my body would remain asleep. So no alarm clocks, okay? And that would be somewhere between 8 and 11 hours, sometimes 12 when it was really, really bad. And that was not normal for me at all. The second part is the quality of your sleep. And so that comes to timing. Again, this is going to be one of those cliches, but cliches are there for a reason. They have merit. They're old stories. They're repeated a lot because they're true and because they're helpful. You need to be going to bed at the same time every night. And you may not get up at the same time because this is more difficult, but you need to be going to bed at the same time to give yourself opportunity. But if you're in bed at different times, your body has a harder time getting into deeper sleep, REM sleep, and where the healing factor really happens. So sleep is broken into sleep hours and sleep time. All right, the next one is diet. And diet is far more important than most people realize, okay? I would say typically, if you're exercising above this, you are not going to recover, okay? You have the best chance of recovering if you just do this. If you just sleep well as this, you also have a great chance of recovering. This actually has almost an instant effect for me. The diet that I'm talking about is an anti-inflammatory diet. It's quite logical. If you eat inflammatory food, you are going to get more inflammation, which means more stress and less ability to recover. So it will increase inflammation and decrease your ability to recover because there's more to recover from. Now, there is an enormous amount to talk about with diet and inflammation and all of this. And I actually became a nutritionist over this last year or so because I had nothing else I could do. I had knowledge on training, I had some knowledge on diet, but I couldn't work, so I had to find something adjacent to that I had a vague level of interest in. Now, I know I obviously didn't have to, but I did. And I will try and keep this as condensed and simple as possible. Anything that is natural is probably not inflammatory, and anything that is processed is probably inflammatory. I'm going to put up an image of foods that are inflammatory and foods that are not inflammatory. When I came back from hospital, I ended up having a Nutella toastie, and almost immediately after, we're talking about half an hour, I felt considerably worse, and I had no idea why. And this pattern repeated far too many times for me to feel comfortable talking about before I realized, hang on a second, this has an impact. So in realizing that, I cut it out. And then by extension, I thought, hang on a second, if I have foods that are actively anti-inflammatory, such as salmon, blueberries, walnuts, all things like that, all right, that reduces inflammation, and in reducing the inflammation, it improves my ability to recover, okay? And so what I actually did was I implemented that and I sustained that, and that really, really helped. Exercise. Now this, there are lots of caveats to this, especially if you're an athlete, and so I will be careful when I describe this one. If you have rested successfully for 3 months, especially if you're an athlete, then it may be time to start considering something. All right. Now, I don't know how early I could have started this or should have started this, but I did it by heart rate, not by... What I actually did when it came down to this was walking, slow walking, ideally in nature. And by doing very short, very low intensity, slow walks in nature, I felt so much better. Even in the days where I really felt like I couldn't do anything because I was so dizzy, I felt very sick, I felt very unwell. If I just went on a very short walk, and when I say short, I really do mean short. It could be 50 meters, 100 meters, less even. There are some days where I just went outside. Ow! There were some days where I would literally just go into the garden, do a couple of laps around the trampoline in the sunlight, and what I think as well is it aided in rehabbing me, because this is the draw with exercise. Exercise improves recovery and reduces inflammation when you do it in an appropriate volume. When you do it in an inappropriate volume, so let's say you go for a marathon or something, a long distance run, something like that, what you've done is you've exceeded your capacity to recover, and then your net is more inflammation. But if you can get the right balance, very gentle walk, something you can easily recover from, and one way you can check that is by looking at your smartwatch and seeing how quickly you return to your resting heart rate after you finish. Don't let it go above 100, ideally, and how quickly does it return? If it takes an hour or more to return to more or less normal, it was too much. If it returns fairly quickly, it's probably okay. What you don't want is to incur more recovery cost because of what you did. You've got to focus on these two things. And the nice thing about exercise is that you can track it with the smartwatch, and over time, you may actually find that this will inform how much you can do. So I got to the point where I was able to get up to full speed with my walking, which sounds insane as a progression, like it's not a great achievement really, but it is when you consider I was stuck at 125 before. Now, when I got to the point where I could actually have regular walks, probably daily, and they could be 10, 20 minutes plus at a normal pace, I started to think, I wonder if I can start to incorporate other movements. Like, can I do some stretching? Can I do some kicks? And it would be the same idea. Does it go above 100? And can I return to my normal heart rate within sort of 15 minutes to half an hour? If that's the case, fantastic. And you can even judge this, because sometimes you'll do too much and you'll do too much again, but the recovery time will be shorter. Obviously, what you don't want is for it to get longer, okay? But you can gauge your recovery purely on the exercise level and the smartwatch. So that's a really key one that helped me. And honestly, these are the main things that I've done. Everything else, I think, has probably been supplementary to what is already being done. So when I'm saying this, I'm assuming you've already been to hospital, you're already taking colchicine, you've already been on ibuprofen, or you're currently on ibuprofen. Now, here's something for athletes, and you've already heard this probably from a doctor, probably from the forums, but I will tell you as well, because it is a principle and it is absolutely non-negotiable. Especially if you're an athlete, you must not return to exercise in full until this is at a reasonable pace, and it has been 3 months. I know 3 months sounds insane, an unbelievable amount of time to be away from your training, but trust me, it is not worth the risk of, a long time with this condition, and even worse, complications of this condition. Now, I don't want to scare you or potentially put you off the whole video, but there are some pretty scary complications of this condition if it gets progressively worse. I personally think the only reason I was able to basically do too much, crash, and then recover again is because I was sort of following some of these, and I would rest and I was able to rest and I didn't have to work for that period of time. But there are many people I have heard of that crash and then kind of just don't, that they just crash, get a bit better, crash harder, get a bit better, crash harder, until it morphs into something worse. And this condition does get worse. It gets a lot worse, and it gets into things that are, they require surgery, and it's the kind of thing that you may not be the same ever again afterwards. So I would implore you, please take this seriously. For the first 3 months, just do exactly, as your doctor says, even if you disagree with them, even if you don't think it's that bad, even when you are a week or two in and you suddenly feel absolutely fine like you used to, and you're thinking, core, I'm gonna lose all of my training adaptations. I'm gonna lose my edge and all of this. Sure. The thing is, though, you're going to lose everything if you don't take this seriously. And there's an upside to this, which is I did lose everything for a year and I got it back. And I would say it probably only took me 2 to 3 months to get back to where I was, because my body just kind of remembered. It kind of had that muscle. There's a whole science to it. But what I'm saying is, if you've been training for a while, you probably will lose your gains, but you're not going to lose them as quickly as you believe you will. Okay, a lot of things is, if you don't train for 2 weeks or whatever, you'll lose muscle mass, or you'll lose endurance, all of this. Yeah, but you'll also gain it back much faster because you already had it. So just keep that in mind. There's an enormous amount of nuance to this condition, and I didn't want to overwhelm you with too much. All right. But if you just do these things, if you just get the smartwatch and keep exercise under 100 beats per minute, if you just get your sleep right, 8 to 11 hours, or just sleeping until you wake up and going to bed at a consistent time, if you keep an anti-inflammatory diet and do not eat anything inflammatory, I know that's really hard. It really is quite hard. But if you can do that, that will be amazing. And then once you are starting to feel a bit better, you progress exercise very, very carefully using objective measures, not subjective measures, i.e., what does your heart rate device say, not how do you feel. You will recover. And you may end up recovering faster than you expect.